Good evening. It's Thursday, April 16th. Thanks for joining us. I'm Maya Trabulsi. We are broadcasting remotely tonight. If dealing with the health scare from the coronavirus isn't enough, now comes critical decisions concerning the economy as millions more file jobless claims. The president is unveiling new plans to reopen the country, while local leaders lay out plans to not only lay off hundreds, but cut services. More on those details in a moment. But first, new numbers just in, showing 3 more deaths and 75 more cases in our county. KPBS reporter John Carroll has the latest.
Supervisor Board Chairman Greg Cox began the county briefing by pointing out it was 65 years ago today that some 25,000 San Diego children received the then new polio vaccine. Since there isn't yet a vaccine for COVID-19, it's important to keep doing everything we can to flatten the curve. Supervisor Nathan Fletcher had a cautionary example of what will happen if we let up. He cited the situation in Singapore, where they did all the right things initially, then lost their focus.
They did not do a series of steps specifically to ease or to unwind, but they did have the public lose the same commitment that they had had in the early days.
Infections in Singapore then shot right back up. Governor Newsom started his daily briefing more than a half hour late. He was delayed because he took part in a conference call between the nation's governors, leaders from some of the G7 nations, and President Trump. While he wouldn't go into specifics, he did say the president will provide a plan on how to open up the economy on a state-by-state level. But he also said California would rely on science, not politics, on how fast to pull back on stay-at-home orders and when to begin the process. Then, the governor turned his attention to his focus for today.
And that's the folks on the front lines of our food delivery system.
Newsom says he's talking about the folks that make things work from farm to table, from the fields where our food is harvested to where it's packed, delivered, and sold. The governor says people working in the food sector have been hit hard when it comes to health and safety. He signed an executive order today to strengthen the food chain by helping the people who keep it going, helping them when they get sick.
That will allow for 2 weeks of supplemental paid sick leave for workers that have been contracted COVID-19, been exposed to it, or have been exposed to isolation or quarantine orders by local health officials, federal and or state health officials.
The governor did get one question completely unrelated to COVID-19 today. Following endorsements of former Vice President Joe Biden for president from former President Barack Obama, along with former rivals Bernie Sanders and Elizabeth Warren, Newsom was asked if he was going to endorse Biden. He said he looked forward to endorsing the former vice president. John Carroll, KPBS News.
The coronavirus crisis has pushed 22 million Americans into unemployment, and that is leading President Trump to reveal new federal guidelines to begin reopening the country. Camila Bernal has the latest.
President Trump says it's time for Americans to get ready to go back to work.
Our team of experts now agrees that we can begin the next front in our war, which we are calling opening up America again. And that's what we're doing. We're opening up our country.
As another 5.2 million workers filed for unemployment last week.
Nothing has worked out at this point.
Lines at food banks multiplied with growing need. In Kentucky and Michigan. Protest against stay-at-home orders.
Us people that are at a lower risk, I feel like we should have continued out our lives and continued working.
With fewer than 500 confirmed coronavirus cases in Alaska, an easing of stay-at-home orders will begin next week.
Folks can go see their docs, again, chiropractors, physical therapists, etc.
But governors of more populated states are increasing mandates, not lifting them.
Let's not make the mistake of pulling the plug too early, as much as we all want to.
I fear if we open up too early and we have not sufficiently made that health recovery and cracked the back of this virus, that we could be pouring gasoline on the fire, even inadvertently.
Camila Bernal, KPBS News.
We're learning more now about just what is in and out of San Diego Mayor Kevin Faulconer's proposed $3.9 billion budget for the next fiscal year. KPBS Metro reporter Andrew Bowen says with COVID-19 ravaging tax revenues, historic spending cuts are in store.
Among the most significant cuts are to library hours. The mayor proposes closing libraries on Sundays and Mondays when they tend to have the fewest visitors. Also, rec centers and pool hours would be cut by 25%. Nearly every city department, including police, fire, transportation, even the mayor's office, is faced with job cuts. Altogether, 354 city jobs are on the chopping block.
Our city is the region's 7th largest employer, larger than Qualcomm. And we proudly employ thousands. And I take that very seriously, especially at a time when so many San Diegans are out of work. Our city employees are in this just like the rest of us. But like every family right now in San Diego, the city has to make tough choices as well.
With restaurants and retail outlets closed, conventions canceled, and tourism completely gone, San Diego's sales and hotel tax revenues have all but disappeared. The total deficit is expected to be $250 million, the largest in city history.
We've never had a month really where the economy that really funds our city budget has come to a screeching halt. We've never had a month like this, and of course, we've never had a budget like this.
With fewer San Diegans driving, gas tax revenues are also falling, meaning road repair projects could slow down. The mayor's spending plan involves a lot of guesswork and predictions about where the economy will be more than 12 months into the future. Things could look better when the mayor presents a revised budget proposal in May, but they could also look worse. Andrew Bowen, KPBS News.
Just moments ago, Mayor Faulconer announced over $1 million to support artists and nonprofits. It's a partnership between the city, Arts and Culture Coalition, San Diego Foundation, and private donors. And county officials have shut down a COVID-19 testing site after it failed to meet proper standards. The move raises questions over how some private companies are running these pop-up locations. KPBS reporter Matt Hoffman explains.
No more cars will be lighting up for COVID-19 and antibody testing at Miracosta College in the North County. The college is not affiliated with the COVID clinic. It just provided space in its parking lot for the drive-through testing. The company had an agreement with the school to use the space for just a week, with terms expiring tomorrow. But days into testing, county health officials ordered the site to shut down, saying it failed to provide necessary state certifications. County officials also said operators would not provide them with testing results, a violation of state regulations and county health orders. Today, officials announced additional findings.
We determined that they do not have a CLIA certificate to be able to do the testing that they were performing. Also, they don't have the certification to be able to send specimens to a laboratory out of state.
Miracosta College officials say as of this morning, the testing operation has stopped. The COVID clinic posted on its Facebook page saying its San Diego location is closed while it goes through, quote, red tape required by San Diego County.
This isn't red tape. This is actually verification of standards and quality. So we are working with them to see if they can refocus their effort.
The COVID clinic was charging $125 for coronavirus tests and $75 for antibody ones, with results promised within a few days. There are similar drive-through testing options in San Diego, but how are San Diegans supposed to know which ones are legitimate and worth their time and money?
I would just do a little bit of buyer beware. If it's a pop-up with an organization that is not affiliated with one of our well-established healthcare entities here in San Diego, I think that would be my first clue.
We reached out to the COVID clinic and its Orange County-based owner for comment on this story, but have not heard anything back. Matt Hoffman, KPBS News.
There's a chance the fired captain of the San Diego-based USS Roosevelt could be reinstated. Defense Secretary Mark Esper told NBC News he has an open mind about the idea. Captain Brett Crozer was fired after writing a memo warning Navy leaders about a coronavirus outbreak on the aircraft carrier. More than 600 sailors have tested positive for the virus, and one has died. The Navy says 94% of the crew have been tested. In an effort to reduce the spread of COVID-19 by reducing the jail population, the San Diego Sheriff's Department is releasing about 400 more inmates without bail. The zero bail state order stipulates that all inmates not charged with a serious or violent offense had to be let go without bail. Sheriff Gore expressed concerns at the sweeping scale of the order, saying his facilities have already taken measures to curb the spread of the illness with screenings and a ban on visitors. Nearly 1,200 inmates have already been released. The Metropolitan Transit Agency says 5 bus drivers have tested positive for coronavirus. All are in quarantine, along with several other drivers who might have been exposed. But KPBS reporter Claire Tregesser says some are staying home without pay.
My name is Tom Jensen, and I am a bus driver for MTS First Transit.
Tom Jensen is wearing his uniform at home, but it's been 2 weeks since he drove a bus.
And I guess that 2 of the bus drivers tested positive. So anyone that drove the bus after the bus drivers were had contact, I guess, and whatever bus drivers did drive the bus were sent home on a quarantine.
That included Jensen.
So the next day they called us that it would be unpaid and told me when to report back to work. Which I think, it takes a lot of nerve to do that.
Jensen's union, Teamsters Local 542, confirmed at least 8 drivers who work for MTS subcontractor First Transit were asked to quarantine because they were potentially exposed to the virus but haven't tested positive. None are being paid. They can file for unemployment, but that's a long process. If the drivers had tested positive, they would get workers' compensation. The union is trying to negotiate payment for everyone. A spokesman for First Transit says in a statement that yes, drivers like Jensen aren't being paid. Drivers that are required to be in quarantine have several options for compensation, including accrued personal time off, vacation, and unused sick time. Employees under quarantine also have additional resources through unemployment benefits and the CARES Act. A spokesman for MTS would not comment on the First Transit employees, but he did say that all drivers who work directly for MTS are paid their regular salary while on quarantine. MTS has asked 6 of its drivers to quarantine, 5 who tested positive and 1 other who was exposed. As for Jensen...
And I'm fine. I haven't had any symptoms. I take my temperature a couple times a day and it's always right on, and I feel fine.
He will be back at work tomorrow, driving his bus. Claire Tregesser, KPBS News.
San Diego Pride is the latest big summer event to be canceled because of the coronavirus. The multi-day celebration, which was scheduled for July, typically draws hundreds of thousands of people each year. Pride officials say it was not an easy decision to cancel, but everyone's health and safety are most important. They're looking into ways to celebrate virtually. And we're following all of the latest coronavirus developments for you at kpbs.org. Just click on the Tracking COVID-19 link on our homepage, and then you'll be taken to a page with all of our recent reports. You can find that right now at kpbs.org. NASA astronaut and UC San Diego alumna Jessica Meir is on her way back to Earth right now. Meir, NASA astronaut Andrew Morgan, and a Russian cosmonaut left the International Space Station today. The trio are set to land after 9 o'clock tonight, our time, in Kazakhstan. Yesterday, Meir tweeted photos looking down at the Earth from space, including the Scripps Institution of Oceanography in La Jolla. We've been enjoying the warm, sunny weather this week, but will it stick around for the weekend? Jeff Cornish has your forecast.
I hope life is good for you right now in Southern California, that you're hanging in there and staying healthy. We do want to take a look at that forecast, and we have slightly cooler weather for Friday, and there will be some extra cloud cover. Spotty showers will occur in some areas. Doesn't look like any significant precipitation for us. There will be slightly more of that into the Sierras off to our north and northeast, but just a quick shot of a little hint of moisture. Then we're quickly returning to pleasant, brighter weather for the weekend. Overnight tonight, not bad out there, just a few clouds, otherwise mainly clear to start. We'll get down to 45 in Ramona, Mount Laguna 42, a little cooler there. San Diego 58 for your anticipated low. Now, into Friday and Friday night, our weak disturbance is going to come in. This is not a very strong storm system, but it'll be just enough to spark some scattered rain showers and perhaps a period of rain that could be a little steadier to the north. You'll notice, if you look closely, we kind of put San Diego on the line, and intentionally so, with a better chance for meaningful precipitation to our north and generally dry weather winning out into southern parts of the region. So we do have some spotty showers around, mainly up to the north of the city. So Oceanside, a wetter forecast in areas near Chula Vista, for example. The rain is a little more likely to the north, and even where there is going to be some shower activity, it looks limited, and we don't expect much in the proverbial rain gauge. There's a weak disturbance that fires through, and as that quickly pulls away to the east, we'll still have a little bit of troughiness or cool air aloft for another day or so, but the weekend will bring some improvements, and things are looking up for us. So the weekend forecast, generally trending drier. Scattered showers pull away into the interior part of the Great Basin, and life is fairly bright for us once again after some morning low clouds give way to brighter skies in the afternoon. Could be a sprinkle or two Monday morning as well. Not a good chance for any meaningful rain, though, in the forecast. Inland areas, some patchy mist, stray shower or two late Monday to Tuesday as well. Into areas a little farther east into the mountains. Here we're running a little cooler, highs in the upper 40s. Morning showers also possible on Monday there. And then into the deserts, here we're generally dry with readings in the upper 70s and low 80s for the most part. I'm meteorologist Jeff Cornish for KPBS News.
While San Diegans are taking fewer trips to locations like stores and parks, urgent care centers are also seeing a decrease in visits. KPBS health reporter Taryn Mento has more.
Up to 100 patients a day used to walk through the door at Sharp's urgent care in Rancho Bernardo. But that average dropped by almost half in March. And this month, Sharp is expecting only about 23 patients a day. Sharp Reesteely's urgent care director, Dr. Phil Efantides, says that's happening system-wide.
Volumes typically we're running about 500 to 600 patients a day. Our volumes now in the urgent care departments overall in the county are down to about 150 patients daily.
Palomar Health and Kaiser Permanente say they're seeing lower patient volumes at their local emergency departments, which handle more severe problems. But since health officials ordered people to stay home during the pandemic, residents have cut unnecessary movement. And Efantides says that translates to fewer urgent medical needs.
People are not in close proximity to each other, and they're getting sick less often. And we're also seeing decreased rates of trauma. We're seeing decreased rates of heart attacks and even strokes. And although a lot of people seem to be stressed out, it seems staying at home has been a good thing for most people's health.
They're also canceling routine non-emergency procedures like a colonoscopy. Still, there is concern fewer patients means people are avoiding urgent care or emergency care centers because they're worried about being in public during the outbreak. The county's chief medical officer, Dr. Nick Efantides, yes, Dr. Phil's older brother, says in some cases, non-COVID patients may be putting off care they need.
These are individuals that have health issues completely unrelated to COVID-19 are coming in potentially with a higher acuity of illness.
He was especially worried about people with cardiovascular issues or stroke symptoms and encouraged them to utilize emergency care. The younger Efantides says Sharp and many other medical providers are offering consultations by video or telephone to make sure patients get the help they need.
We're doing at Sharp Reesteely system-wide about 22 to 2,500 telehealth visits daily, either by telephone or by video visits, and that has significantly ramped up in the last 3 to 4 weeks.
But he says those figures are still less than the 6,000 to 8,000 daily in-person visits Sharp Healthcare used to see across all of its facilities. Taryn Mento, KPBS News.
President Trump has repeatedly praised a drug called hydroxychloroquine as a potential treatment for the coronavirus. It's seen some success, but is largely untested. iNews source reporter Mary Plummer has more on the drug's usage and its availability in San Diego.
Some local hospitals are stockpiling the drug for COVID-19. Others say they won't use it to fight the virus. San Diego patients who've long relied on hydroxychloroquine for conditions such as malaria, lupus, and other autoimmune disorders are running into delays and drug shortages. Lori Madigan is one of them.
For someone like me with rheumatoid arthritis, it's the difference between life with manageable pain and life with excruciating pain.
Madigan rushed to fill her prescription the day she read that President Trump had mentioned the drug. She had a delay, but eventually was able to get a 3-month supply. iNewsSource found availability varies. Kaiser and Scripps are saving the drug for severely sick coronavirus patients and restricting some prescriptions. San Diego pharmacist Sally Rafey said some local doctors and dentists stockpiled the medication for themselves, adding to the supply shortage.
People started to think that they needed to keep some of this medication on hand should they or like a loved one end up needing it. So there were some initial kind of prescribing of this for individuals within the family or for themselves, and pharmacies, of course, trying to stock up in anticipation.
Rafey and county health officials don't recommend the drug for coronavirus patients, but Kaiser, Scripps, and Sharp all confirmed to iNewsSource that they've used it. For KPBS, I'm iNewsSource reporter Mary Plummer.
You can find more on this story at inewssource.org, and iNewsSource is an independently funded nonprofit partner of KPBS. Governor Newsom announced the state will provide undocumented workers with one-time payments during the pandemic, but KPBS reporter Max Rivlin-Nadler tells us this might not be enough to offset the economic impact on the workers that the state relies on for so much.
As federal stimulus checks hit the bank accounts of millions of Americans this week, one group of mostly essential workers have been left out: undocumented workers. On Wednesday, Governor Newsom announced a plan that, using a mix of taxpayer money and charitable contributions, the state would give 150,000 adults between $500 and $1,000 each during the coronavirus outbreak. There are an estimated 2 million undocumented people living in California.
In the areas that are so essential to meeting the needs of tens of millions of Californians today, in the healthcare sector, in the agriculture and food sector, in the manufacturing and logistics sector, and in the construction sector.
Dr. Kara Green is the executive director of the Center on Policy Initiatives, which advocates for working families in the San Diego region. She says janitorial, hotel, and retail workers have all been hit hard by layoffs or a massive reduction in hours during the pandemic, with people both having to work in dangerous conditions or not working at all.
Many of these jobs are already at the poverty level or just above, and so people are not going to be able to make ends meet on half or 3/4 of their salary.
Undocumented workers cannot apply for unemployment insurance, even if they've been paying taxes, leaving them without resources during this burgeoning recession. Marta Orozco lives in North Park. She's undocumented and works cleaning houses across the city after years of working at a restaurant. She's paid taxes in the U.S. for over a decade. She thinks that a $500 one-time payment from the state isn't near enough to help undocumented workers. She says that it's discriminatory to have undocumented people receive so much less than everyone else, even though they've been paying just as much in taxes. She says they've been working the harder jobs. She's worried that even when the state figures out how to dispense the payments to workers, many won't sign up for it, out of fear of having their identities shared with federal immigration authorities. Max Rivlin-Nadler, KPBS News.
I'm Judy Woodruff. Tonight on the NewsHour, deaths in the U.S. break 30,000 as millions of Americans file first-time unemployment claims. Coming up at 7 after Evening Edition on KPBS.
June SAT testing has been canceled while a home version of the college entrance exam is being prepared in case schools are still closed in the fall. The College Board said instead of paper and pencil tests, the digital version could include the use of the computer's camera and microphone to monitor the movement or talking during the test. Coronavirus closures forced the cancellation for the test for about 1 million students planning to go to college the following year. The College Board says if it's safe, they will resume in-person tests in August. As the coronavirus continues to spread, the information about it can be overwhelming. But as Mandy Gaither tells us, experts say there are 5 things everyone should know about this pandemic.
From face coverings to infection rates, a lot of pandemic information is being put out there right now. But doctors from the Yale School of Medicine say there are 5 things to know. First, information about the novel coronavirus is evolving. There's still much more that needs to be learned, including more about how it spreads. It's currently thought to go mainly from person to person, from droplets when an infected person coughs, sneezes, or talks. And even if a person is not showing symptoms, they still might be able to spread the virus. Second, experts are working to reduce infections. Vaccine trials are currently underway, but it could take a year or more for one to be deemed safe and effective. Third, if you have symptoms, cough, fever, shortness of breath, call your medical provider or seek emergency help if you have symptoms like difficulty breathing or chest pain. Fourth, protect yourself. Wash hands, clean surfaces, don't touch your face, stay at home. And finally, precautions are critical. Trust reputable health organizations like the Centers for Disease Control and Prevention and the World Health Organization. Follow their recommendations to slow the spread. For today's Health Minute, I'm Mandy Gaither.
Scripps Memorial Hospital Encinitas staff came together to celebrate the release of a special patient. 73-year-old Eva Meese became the first coronavirus patient at the hospital to be discharged after going on a ventilator. So far, 144 coronavirus patients have been discharged from Scripps' 5 hospitals in San Diego County. And you can find tonight's stories on our website, kpbs.org/evening edition. Thank you for joining us. I'm Maya Trabulsi. Stay safe and good night.